Good morning, all. Can we start our class? Good morning, students. Can we start our class? Okay. So today's topic is about gynecological surgery. So you would have learned about the theoretical aspect of this gynecological. So gynecology is the study related to peculiar disease that are affecting only women. So gynecology is a branch of medicine in which we will be studying the peculiar disease that will be affecting only the women. Okay. So in that gynecological aspect, we are having many of the disease, and some of the disease need to have a surgical correction, or some of the disease need to undergo a surgery. So as a physio, we don't have much role in many of the gynecological disease, but uh, in case of surgery, definitely as a PT, we have a main role. So, like normal other surgery, or like your normal medical surgical condition, in gynecological surgery also we have the same role. Our role will be to prevent certain complication and to enhance the healing. Okay. So today we will see about the assessment and the treatment management treatment protocol. So today, like in gynecological surgery, if you see, like you will be having vaginal hysterectomy, abdominal hysterectomy, and mastectomy. So vaginal hysterectomy is like there are many types of vaginal hysterectomy and there are many types in abdominal hysterectomy. But we just see the vaginal hysterectomy into one part, that is through vaginal vagina any surgery is done, or through abdomen any surgery is done. That means the gynecological surgery is grossly divided into two sections. One is the surgeries that are done through vagina and surgeries that are done through abdomen. So as a PT, we can just divide the surgeries into these two aspects, and we can go with this two. That is like majorly we can our PT part can be just divided into this two, through vagina and through abdominal hysterectomy. And I can also say that, so whenever you see any whenever you are seeing any patient undergone a vaginal hysterectomy, this will be same like a women who has undergone a normal delivery. And whenever you see a person who has undergone abdominal hysterectomy, it is same like a person who has undergone a cesarean section. Because in abdominal hysterectomy also, you will be having midline incision, and you will be having fenestrial incision. So the overall protocol will be same like your cesarean section and your normal delivery section. Okay. Then mastectomy is nothing but removal of the breast tissues. So this mastectomy is done for people who are having breast cancer and who definitely are in stage 4, or they have a malignant cancer or anything. Whenever they feel that they are not able to control the cancer, then they will go for removal of the breast tissues. So in this mastectomy, you have something called mastectomy along with axillary lymph nodes, or a like a radical mastectomy. So that is called mastectomy along with lymph nodes. Okay, so axillary lymph nodes. So these are the three major category of gynecological surgery. As a PT, we have a major role. So now we will go into the PT aspect. So as a PT, first thing we will be having a pre-operative PT care and post-operative PT care. So pre-operative PT care is, we have to listen to them and we have to understand what are their problems, and according to that we have to take steps to prevent certain complications. So for example, if a person is a chronic smoker and already like she has some COPD, then we have to prevent the we have to try to prevent, maximum try to prevent the uh, we have to maximum try to prevent the respiratory complication. Is that clear? So our PT main role is prevent certain complications or take steps to prevent the complication, and to speeden up the healing process and to make them normal as early as possible. So that is our major role. So pre-operatively, like we will see the assessment. So never mind pre-operative or post-operative, our assessment will be same. So in the assessment part, first you will be having subjective assessment. Subjective assessment will be your demographic data. After that, mainly the hobbies and lifestyle activities. So that is very, very important for you to know. Then the chief complaints. So chief complaints here will be in case of pre-operative, if they have any medical problem, that will be the chief complaints. Otherwise, they won't have any chief complaints. In case of post surgical, then like the pain over the suture site, then difficult whenever they are coughing, they have pain, and difficulty in moving from bed, or difficulty in standing up, sitting down. All these will be the chief complaints. So post-operatively, mainly the pain will be the chief complaint. Pre-operative, in case if they have any medical problem, then that will be the chief complaint. Then in the history taking, present regarding the onset of the problem, personal history regarding their hobbies, activity like diet, their day-to-day life activities, all those things will be the will come under the personal history. Then medical history, all existing problem and their medical management. Then next is like obstructive history. So obstructive history, you have to go with G, P, A, and L. G is gravida, how many conception, how many times they conceive. Then P is parity, how many times they delivered. A is abortion, and L is number of live birth. So G, P, AL. And in that, like in parity, what is the type of delivery they have undergone, whether there is normal vaginal delivery or assisted or cesarean section. So in case if it is like assisted or like the cesarean section, then you can just guess the abdomen will be already weak. Okay, then next is gynecological history regarding the hormonal imbalance, whether the regularity of menstrual cycle, those will be coming under the gynecological history. If they have any hormonal imbalance, definitely you can expect certain disease like osteoporosis and obesity. So that's why you need to ask about the hormonal imbalance. Then surgical history, any previous history surgery they have undergone, including the cesarean section. Then previous medical management, previous surgical management, on any other previous management they have undergone. So these things will come under the subjective. So please keep in mind the both the pre-operative and post-operative, the assessment will be same. Then in the objective examination, you need to check with the general physical condition, because Many of the gynecological surgery will be done in very old age, sometimes in 60s, sometimes in 70s, something like that. It is also done in 40s, at the age group of 40 and 45, but still many of this gynecological surgery will be done at the age of, like, at the older age. So you have to check the general physical condition of the person. So how they are able to walk, how they are able to move their limbs, like whether they are having a flexibility in all the joints, whether they have any deformity, all those things you have to check in general physical condition. Apart from that, general mobility is how far they are able to move their joints. So whether they have any reduced range of motion in certain joint, and if they have reduced range of motion, whether it is because of muscle weakness or muscle tightness, you have to check that. Then how is their general mobility in walking, whether they are able to walk normally or they need any assistance like canes, walker, or they need to hold anybody, any person, personal help is needed for them to do their day-to-day activities like moving in the bed, getting up, dressing up, walking to the restroom, like that. So this comes under the general mobility. Then next is, since it is a surgical, since they are a surgical patient, both pre-operative and post-operative, you have to check for the respiratory system. So you have to check whether the air entry is equal and air entry is adequate, whether they have any secretion. If they have any secretion, what kind of secretion they have, whether they have wheeze, whether they have any other chest complication, all those things you have to check. Then regarding the circulation, any circulatory problem like varicose vein, whether the women has any chance of getting DVT, all those things you have to check. Then any special potential physical problems like if they are sitting for a long time, whether they have back pain. If they are sitting for a long time, whether they will have edema in the legs. If they are sitting for a long time, whether they will be having thoracic pain. If they are sitting for a long time, whether they have any other issues, or if they are walking or standing. So not only sitting, any activity when they do prolong, whether they have any problems. So that is your special potential physical problem. Sometimes whether they are deaf, whether their hearing problem, hearing is has reduced. So all these things will come under any special potential physical problems. Then any special concerns of the problem patient. Any special concern means already if the patient has respiratory complication, already the patient has reduced lung capacity, or already the patient has more chance of DVT. So all these will come under the special concern of the person. So why you need to know about the special concern is then only you will be able to plan her protocol. That's why you need to know about the special concern. Then next is their posture. Then like if they have any incontinence, then pain scale will be in the post-operative. Okay, so post-operatively, you need to check their pain. What is the type of pain? What are the intensity of the pain? What are the activities that is increasing the pain? What are the activities that is reducing the pain? So that will come under your post surgical or post operative assessment alone. Then prepare a problem list. So mainly their problem will be difficulty in moving in the bed, and difficulty in coughing, difficulty in getting up and do their activities alone, pain, then sometimes swelling or any other issue. So those will be your problem list. So aim of our treatment is in the pre-operative, we need to prevent any chest complication. Then like improve their mobility as early as possible and make them independent as early as possible. So that will be our pre-operative aim. So post-operative will be to reduce the secretion, to enhance the healing, to reduce the pain, to improve the ADL independency as early as possible, to make them mobile as early as possible. So that will be our aim. So So in preoperative, if you see, we will be concentrating mainly. So in preoperative, mainly if you see, we will be giving the instruction and we will be preparing the patient. So first thing we will be doing is like we will be doing the assessment. Second is we will be giving the instruction and we will be preparing the patient. So instruction mainly to give them advices what are the first thing they are supposed to do immediately after the surgery. So to first thing, what are the first thing you have to do is you have to do breathing exercise and prevent the like try to prevent the complication. Then you need to do pelvic floor exercises to improve the healing, and you do the abdominal exercises to improve the healing. So these are the instruction or preparedness you will do. So our main emphasis will be on respiratory system, that is teaching coughing and huffing technique, breathing exercises, ACBT, active cycle of breathing technique, then partial drainage in case if they have more secretion. So for many of them, immediately we will not put them in partial drainage, because after surgery, if you put them in partial drainage, that will stress and that may cause bleeding on the suture side. So that's why we will not be able to put partial drainage. Maybe we can go for modified partial drainage in case if we need. But most of the time we will be avoiding partial drainage. Okay, then so to in respiratory system, mainly you have to teach them how to cough, how to cough. So you need to teach them what is the difference between coughing and huffing, teach different types of breathing technique, breathing exercises. Then ACBT. ACBT, I hope you all of you know, active cycle of breathing technique. Okay, so these are the things you will be teaching them and you will be making them to do in the prenatal, pre-operative, so that they will be able to do it after the surgery. So this is main thing, because many of the patient will have respiratory complication after the surgery. The next emphasis will be on the circulatory system to prevent DVT. So if they are in the bed for a long time, definitely they are going to end up in DVT. And already because of surgery, they will be stopping this blood thinning medicine. So if they have taken blood thinning medicine, they will be stop. They will ask you to stop the blood thinning medicine. So in that case, there is more chance of getting DVT. So you have to emphasize this. So when they immediately stop this blood thinning medicine, the blood will undergo thicken and there is more chance of venous thrombosis. So you need to be very careful. So you can advise them anti-embolytic statins if you think there is a need for that. Then early ambulation, that is make them to be mobile as early as possible. Then ankle pump exercises, that is very very important. Then third is bed mobility. So you need to teach them how to take rest, that is comfortable lying position. So they have to keep, in case if they have undergone abdominal hysterectomy, you have to keep a pillow under the knee, so that the abdomen muscles are uh, not pulled or abdominal muscles are not stretched. So keep a pillow under the knee so that the abdominal muscles are relaxed and the patient doesn't have any pain. So teach them how to lie down in supine, how to lie down in the side. They cannot go for prone lying. So only in the sides and in the supine they have to lie down. So teach that particular position. Then teach them how to get up from bed. So how to get up from bed? Definitely they have to come to side lying. Then push their legs down. Then keep their hands and get up. So bed mobility you have to teach them. Then slowly how to get up from the bed and how to walk. So all these things you have to teach them in the pre-operative itself, so that it will be easy for them to do during the postnatal. Because of pain they may not be able to walk upright. So they are supposed to hold the abdomen or brace the abdomen properly and try to walk straight. Okay, so immediately after surgery, the abdomen will be very loose and it will be pulling here and there. So they will have severe pain. So they will not do the movement, or they will not try to get up and walk. But if they are not trying to get up and walk for a long time, then they may end up in complication. So you have to encourage them to get up and walk. So in case if they need any walking aid or anything, you can give them any particular walking aid. Then next is pelvic floor exercises. The next is abdominal exercises, then posture and back care. So we will see. Then the last one, which is very different from other things, like normally because of the abdominal surgeries or because of any surgery, the air will be getting trapped in the intestine, and it will be causing it will be so much painful, and the passing of the pain of the air itself will be so difficult. So you need to encourage them to be mobile as early as possible. You can go for abdominal massage. Then you can also do gentle abdominal exercises. This will help them to loosen the release the air, and this will be the release the pain. So you can also teach them single leg sliding. That will be helping them to make the gut mobile, and that peristaltic movement will be increased, and the air that is getting trapped in the intestine will be released. So post-operatively, you are going to follow the same thing, same exercises you will be doing in the post-operative also. So now we will see certain videos how to do all these exercises. Okay, so many of the exercises you have already seen, like I'm not, is the slides clear now? Sorry, I did not see the message at all. Is it clear now? Okay, many of the exercises already we have seen. So first is like a diaphragmatic breathing exercise. So first is diaphragmatic breathing exercise.
Today I'm going to teach you about diaphragmatic breathing. This is a great technique used for relaxation as well as for pain management. Start laying down. You want your knees bent with your feet firmly on the table or on the floor. What you're going to do is you're going to take one hand, you're going to place it on your chest, one hand you're going to place on your stomach. What you're then going to do is take a deep breath in through your nose and exhale out through your mouth. I want you to do that about 3 times. At this point, I want you to think which hand or hands is moving. You should feel that your stomach is moving when you take a deep breath in through your nose. However, if you feel that both hands or just your chest is moving, that means that you are using your neck muscles and other muscles to help with the breathing process versus using your diaphragm. So now what I want you to do is I want you to think about when you take a deep breath in, that you are getting all the air going in through your stomach. So I want you to visualize it as you go. You're taking a deep breath in through your nose. It's coming down past the back of your throat, into your chest, and down into your stomach, and expanding your stomach. At this point, I want you to think about letting that air come out of your stomach, back up into your chest, into the back of your throat, and exhale through your mouth. And it should look like this. Notice again that it's only my stomach moving, not my chest. So once you've mastered the lying down diaphragmatic breathing technique, the next progression is sitting up. Here you have to work against gravity to hold yourself upright. What you want to make sure is that your feet are firmly planted on the floor. Sitting nice and tall, what you're going to do is take one hand, place it on your chest, one hand on your stomach. As you breathe in, again, you should feel your stomach expanding, and as you exhale, your stomach should be deflating. So again, taking 3 deep breaths, I just want you to think which hand or hands is moving. As you can see, only my chest is rising. So again, what we want to do, and I even have people close their eyes to visualize this, you're going to take that deep breath in through your nose, make it all the way down into your belly, make your belly expand, deflate your belly, and exhale through your mouth. And that is diaphragmatic breathing. Now that you know the technique, this is a great thing that you can do when you're at the office, driving in your car, anytime you're in a stressful situation. It'll help relax everything and just get your diaphragm to work a little bit harder in breathing versus your neck muscles.
Next is chest expansion exercises. Okay, so we will see the segmental expansion exercises. Are you able to see this?
Hello everyone. Today I will be showing how to give segmental breathing exercises. In my earlier video, I had shown how to give diaphragmatic breathing exercises, the link of which has been provided in the description box. Segmental breathing exercises is given with the purpose of expanding the hypoventilated areas of the lung or the segments of the lung whose expansion is affected because of certain factors like pain and muscle guarding following surgery, atelectasis, pneumonia, basal breathing exercise. There are 3 types of segmental breathing exercises: apical breathing, lateral costal expansion, and posterior basal expansion. In apical breathing, we concentrate upon the apical areas of the chest. In lateral costal expansion, we concentrate on the lateral costal aspects of the chest, and in posterior basal expansion, we concentrate on the posterior basal expansion of the chest. I will show you how to give lateral costal expansion. In lateral costal expansion, our focus should be to expand this part of the chest. Position of the patient should be in sitting. We can make the patient sit on a bed, or we can also use a chair without a backrest. While giving lateral costal expansion, we need to take care that the muscles of the shoulder and neck are completely relaxed. We will ask the patient to breathe out through mouth and then breathe in through nose. attempting to expand the lateral costal areas of the chest. I will place my hand on the lateral costal area of the chest. Asking the patient to be completely relaxed, I will turn his face towards the other side away from me, and then I will ask him to begin by first breathing out through mouth and then breathing in through nose. से सांस बाहर निकालो और नाक से सांस लो. इस एरिया को फुलाना है. While doing so, I can also apply little resistance using my hands throughout the inspiratory phase. The purpose is to strengthen the respiratory muscle. I can also use mild stretch at the beginning of the inspiration to give proprioceptive stimulus. Placing my hands like this at the beginning of the inspiration, I will apply mild stretch slightly downwards. This gives a proprioceptive stimulus to the respiratory muscle. Now I am going to show how to give posterior basal expansion. In posterior basal expansion, this is precisely the area that we will concentrate upon. This is the area of the lung that needs to be expanded. Posterior basal area expansion is very important, particularly in post-operative patient, because it is in these areas that the secretions post-operatively tend to get accumulated. Now let us see what is to be done. The positioning of the patient should be in high sitting. We can make him sit on a plinth, we can make him sit on a chair, but without a back support. We will make sure that the muscles of the shoulder, the neck are properly relaxed. The sternocleidomastoid, the upper trapezius and the levator scapulae muscles should be completely relaxed. We place our hands on the posterior basal area of the chest and we ask the patient to try and expand these areas while breathing. He will take in breath through nose and take out breath through mouth. I will instruct the patient to do so. पहले सांस निकालो मुंह से और फिर नाक से गहरी सांस लो. नहीं, आराम से, आराम से. It is important to instruct the patient to do this in a relaxed manner. The respiratory rate will be disturbed if the patient exerts himself too much during respiration. I can also use my hands to give slight resistance throughout the inspiratory phase. The same resistance can also be given using a belt. During inspiration, the belt should be wrapped around the chest wall and it should be slightly tightened.
You can see one more thoracic expansion exercises. One more
Hi all, welcome to video on thoracic expansion exercises. You might have been doing this before but don't know that these are breathing exercises, so let's know them in detail.
Our lungs stay within the ribcage, and the ribcage is not only made of bones but also made of fibroelastic tissue called cartilage, which makes it slightly flexible. It can expand front to back and side to side by its bucket handle and pump handle type of movements.
We can further improve the movements of the ribcage by moving our trunk and shoulders. Combining these movements along with breathing are called chest or thoracic expansion exercises. To do the exercises, choose a comfortable position, sitting, standing or even lying down.
Slowly breathe in and raise your hands from the front. Breathe out and let the hands down. This works for front areas of your lungs. For sides of your lungs, raise your hands by the side of your body while you breathe in. Breathe out and bring your hands down. You can also do these exercises on single side with single hand. Use of both shoulder and trunk movements with breathing can further increase the lung expansion.
Coordination. That means proper combination of your breath with the shoulder and trunk movements is the key principle of this exercise. When we move our hands upwards from front or side, or whenever we are moving the trunk sideways, it is increasing the spaces between your ribs. This is creating extra space for the lungs to expand. Making use of this, we are breathing in more amount of oxygen. Similarly, when we move our hands down, the space in between the ribs reduces. This gives a slight squeezing effect on the lungs. This helps us to remove carbon dioxide efficiently from our lungs and gets our lungs ready to inspire more amount of air or oxygen in the next breath.
The benefits are not just the movement of oxygen in and out of the lungs. These exercises also maintain or improve lung volumes and ribcage mobility. Before and after any chest or abdominal surgery, these are some of the mandatory exercises. Chest expansions when followed by coughing helps in clearing of phlegm and mucus accumulated in the lungs.
By this exercise, you can breathe in more amount of oxygen and also can remove more amount of carbon dioxide from your lungs efficiently. Do it the right way, enjoy the benefits. See you in the next video. Until then, take care.
So these are the exercises to improve the air entry in the lungs. So you can teach them diaphragmatic breathing exercise, segmental expansion exercises, and chest expansion exercises. So all these three will help them to increase the air entry, and it will help them to maintain the posture. So the last chest expansion exercises, if you see, this will help them to improve the posture as well as improve the uh, improve the air entry. Is that clear? So we need to teach all these things in pre-operative. We make them to practice pre-operative, then ask them to start immediately after the surgery or as soon as they come out of the anesthetist effect. Okay, so the last one in the breathing technique is your ACBT. ACBT is active cycle of breathing technique.
Active cycle of breathing technique. It is a 3-phase cycle. The first phase is breathing control. Place your hand on your stomach and take a relaxed breath in through your nose and a relaxed, gentle breath out through your mouth. You want to be looking not to expand into the chest, but to expand into the stomach on the breath in. If you find on the breath out it is difficult with an open mouth, you may prefer a pursed lip breath. Repeat this for 5 times. After the 5th, move on to phase 2, the thoracic expansion exercise. Here, place your hands onto your rib cage. Take a longer, deeper breath in through the nose, and then open the mouth and take a gentle, long breath out through the mouth. During this phase, you're looking to get the movement of the ribs out, like so, and then come back in again on the breath out. Again, on the breath out, if you find it difficult with an open mouth, purse your lips together, and this will make it easier. After the 5th, you can either go back to phase 1, the breathing control, or move on to phase 3, the forced expiratory technique. Here, you can mimic steaming up a window or mirror by using your hand. You take a long breath in through the nose, and then open the mouth to huff out. And again, if you feel you can do it without using the visual aid of your hand, you can continue the practice. You can do it by taking a smaller breath in through the nose and a longer huff out through the mouth, or a longer breath in through the nose and a short, quick huff out through the mouth. At this point, you may feel the need to cough and clear.
Okay, so these are the breathing techniques. Okay, so next will be like you need to teach them how to be mobile in the bed. That is bed mobility along like after immediately after the surgery, how to be mobile in the bed.
Show you a really quick, easy technique for getting out of bed safely after you've had abdominal surgery. Now, when you've had abdominal surgery, often the incision is through your abdominal muscles. So this technique involves getting out of bed without using your abdominal muscles. So it's going to help you ease pain, ease discomfort, and help you move a lot more freely. So we're going to start lying down on your back. Now, you might like to use a pillow or a cushion to help you with this technique. I'm going to start lying down here now. And our first step is to get our cushion and bring it over our belly. Now, when we're going to move and to move safely in bed, I'll get my legs down. I'd like you to slide one leg at a time along the surface of the bed. So don't bring both legs up at once, just one at a time. That will be comfortable. Now, keeping the pillow against your abdomen, you can lift your bottom up, and that shouldn't feel uncomfortable at all, and move it away from the side that you're going to roll towards, just to give yourself some space there. Right, now I've made some space here. You can very comfortably lift your bottom up in the air. You'll find that won't cause you any discomfort, and it's a great way to move around in bed because it's not using your tummy muscles. Now, here's the second step. We need to roll like a log onto your side. So when I say like a log, I mean bring the arm over and roll the whole body at once, not twisting through the trunk. So we're going to go 1, 2, 3, holding your pillow and roll like a log. So see how I rolled all in one movement. Now, you've got to be right on your side here to then move yourself up. Your underneath arm comes up, and that's going to be our pushing up arm to move us up sideways. Our legs are going to lift and lower over the bed at the same time. If you split this up and try and lift one part of your body and not lower your legs at the same time, it's going to be much more difficult. Let me demonstrate what we need to do. Elbow comes down, other hand makes a fist here, and the legs lift and lower. And it's a 1, 2, 3. Push up and move up sideways, and you might still have your pillow there, and then you're up. That didn't use my tummy muscles, it used my momentum and muscles in the side of my body to then actually lever myself up. So you can see, I'll just repeat that one more time. So coming back onto the side. So this lower arm pushes down, the top arm makes a fist here, or use the heel of the hand. At the same time, the legs swing up and over, and then you're going to move like a pendulum. 1, 2, 3, and bring your shoulders forward as you come up, and there you are. The slower you do that, the harder it is. And there you are. To get back into bed or to get back into lying down, it's exactly the opposite. And I'll get rid of the pillow this time. I'll use that for my head. Basically, you bring your arms down, and you're not going to lie down then and try and lift your legs up because that's going to feel way too hard. You do it again all together in one movement. So the hands come down and lie down onto your side, all in one movement. Then we don't, again, twist through our trunk or twist through our wound. Rather, roll like a log, come onto your back, and then use your bottom muscles, reposition to get back into position like that. So there you have it. I'll come onto my side and come up. So getting in and out of bed after you've had your tummy surgery, if you haven't had tummy surgery, you really don't know what it feels like, and you really don't appreciate how challenging this can be. It involves those easy steps of rolling onto your side, moving like a pendulum, lifting up, and to get back into bed, moving down, again, pendulum format, rolling over onto your back and lifting your bottom to reposition. So I really hope that little technique helps you move safely and comfortably after your surgery.
So I'll show you one more video related to mobility in the bed.
This video will provide you with information on how physiotherapy aids in your recovery from surgery. Maintaining a healthy lifestyle before your surgery is important. Regular exercise such as walking or cycling, at least 30 minutes a day, helps to keep your body fit and facilitate recovery after surgery. It is also recommended that you have a healthy and balanced diet, as well as to stop smoking, as smoking can slow down your body's healing ability. Effects of anesthesia and wound pain can affect your breathing and effectiveness of coughing, possibly leading to the retention of phlegm. Prolonged bed rest can also cause muscle weakness, delaying your road to recovery post-surgery. Physiotherapy can help to tackle these problems by assisting in chest care, limb exercises, and early mobilization. It is important that you clear your phlegm to prevent chest infection. You may feel pain when coughing, hence supporting your wound as you cough can help you cough effectively and with less pain. Support your wound by placing a small cushion over it. Provide a gentle but firm pressure. Take a deep breath in and cough strongly. You can take in 3 to 4 deep breaths before supported coughing to clear phlegm more effectively. This cycle can be repeated after a short break until phlegm is cleared. Deep breathing regularly using the incentive spirometer after surgery is strongly recommended to prevent post-surgery complications pertaining to breathing. It has a mouthpiece, a yellow piston on the left, which indicates the volume of inhaled air, and a small yellow indicator on the right to indicate the breathing speed. First, affix the mouthpiece to the device. Sit upright on a chair or prop yourself up in the bed as high as you can. Hold the incentive spirometer in an upright position. Place the mouthpiece in your mouth and seal your lips around it. Breathe in slowly and deeply as possible. Try to keep the yellow coach indicator on the right in the smiley face as you do so. Notice the yellow piston rising on the left. Hold your breath for 3 seconds. Then exhale slowly and allow the piston to fall to the bottom of the column. Rest for a few seconds and repeat the steps 10 times every waking hour. Limb exercises help maintain muscle strength, improve exercise tolerance, and facilitate blood circulation to prevent blood clots forming as a result of reduced activity after surgery. Here is how you can exercise your arms while in bed. First, lift your arm out towards the ceiling, then bring it down. Repeat 10 times. Second, bend and straighten your elbow. Repeat 10 times. Here is how you can exercise your legs while in bed. First, slide your leg up and down on the bed, bending your hip and knee as far as possible, then straighten it. Repeat 10 times. Second, keeping your leg straight on the bed, move it away from the other leg and back. Repeat 10 times. Third, move your ankle up and down. Repeat 10 times. Sitting out of bed on day 1 after surgery is usually recommended. To get out of bed safely with minimum pain, start by rolling to your non-surgery side. Move your feet off the bed or keep your thighs on the bed. Push yourself up with your arms. You will then be assisted to be transferred onto a chair. To facilitate early discharge, moving around as soon as possible after surgery can help improve exercise tolerance and maintain muscle strength. The painkillers may make you feel nauseous and giddy. Thus, you are advised to begin walking with your nurse or physiotherapist unless advised against by your doctor. Lastly, it is important to take a break if you experience symptoms such as breathlessness, extreme pain, and giddiness. Stop the exercises if the symptoms persist and inform your therapist, nurse, or doctor immediately.
Okay. So apart from these exercises, you will be making them to do ankle toe movement. You will teach them hand circulation exercises, that is wrist or hand squeezing exercises, or like finger opening up and closing exercises. So this exercises will help you to improve the circulation and reduce DVT. Okay, so this is one side. Then next is you will gradually move into pelvic tilting exercises, isometric abdomen exercises, isometric back exercises, then leg sliding exercises, along with then graded abdominal exercises. So initially you will start with isometric abdomen and back, then pelvic tilting, then you will slowly go into the graded abdominal exercises. Is that clear? So all these videos already we have seen. So do you want me to show you again? Are you guys there in the class? Okay, so I'll show you again. First is isometric abdomen exercises.
Abdominis muscle. So we'll do an isometric. So our next exercise is an abdominal contraction exercise, focusing on your lower abdominal area, which is called your transverse abdominis muscle. So we'll do an isometric. So first you'll place both fingertips of both hands on your low belly or pelvis bone area. You'll be comfortably relaxed with the knees bent, with very relaxed and normal breathing. So the area of focus is between your fingertips. There are many different cues we use to engage these muscles. One is the idea of gently drawing the muscle inward that's underneath your fingers. Excellent. And it's really important to maintain normal, relaxed breathing. If that felt difficult, some people will consider a small zipper that comes from the crease of their hips towards their fingers, or from their fingers inward, gently drawing in, again maintaining normal breathing. You'll try to hold this contraction approximately 10 seconds to ensure relaxed breathing, and you'll try to do this 5 repetitions 2 to 3 times per day. Some of the things that people do in error with this exercise is they actually try to do a pelvic tilt or flattening of the low back, which is not what we want ideally, or they will actually draw air in under their ribs, lifting up and arching their back. Also not what we want. So relax there. And that was great.
This is abdominal exercises.
Hi, I'm Margie Weiss. The name of this video is How to Stay Fit Over 50, and this segment that we're doing is the abs, the core. There are a lot of different muscles in the core. Most people know what a crunch is because they've been doing it all their life, but they've probably been doing it wrong all their life. The idea behind working your core, especially your abs in the front, and abs are in the back as well, but is to make sure that the belly button and the lower abs contract downwards as you work. If the muscle can go down or it can go up, and if it goes up, you're gonna build a dome in your lower abs, and we don't wanna add volume to our abs. We want to get them toned, but we want them as contracted and as small as possible. So anytime you lift into a crunch, whether it's arms or legs, first you wanna breathe out, press your belly button to your backbone, and hollow your lower abs. Try to press your lower back into the floor. In order to do that, squeeze your glutes, because they're involved too. That way from here to here is all involved in every crunch workout. It's not an exercise for your neck, so doing this up and down is not gonna get your abs any stronger. If you do ab work where you're lifting your chest, basic crunch, she would probably have, at first, hands behind the head, because that way you're supporting your head. You don't have to if you're strong enough. But if she was doing that, if you put your fist right under the chin, as she lifts, her nose is coming straight up, and her space between her chin and her chest is still there. What she doesn't want to do when she comes up is crunch this way, because now she's gotten her neck extended, but she hasn't done anything more for her core. So as she comes up, her chin's going straight up, kind of feels like your chin's going to the ceiling. And what happens here, as you'll notice, when she goes down and comes back up again, it's going down and under as her chest lifts. So her belly button's going to the floor. You're gonna breathe out on the rise so that you get rid of the volume of your lungs, and then breathe in when you get to the bottom. Every time you come up, you squeeze the glutes as well so that your lower back is on the ground. Now you don't have to have your hands behind your head. If you're a little bit more advanced, you can put your arms right down next to your thighs. And if you want, you can even put a weight in both hands, because that way you can generally come up a little bit higher. So you can do that crunch, and because you have a counterweight there, you can get up a little higher. But again, don't make it a neck exercise. It's rib to hip. The rib and the hip bone come together. In order to come together, the belly button has to get out of the way. So it's got to go down as the body comes up and as the rib and the hip come together. So that's a basic crunch, and that's the one that most people know how to do. But it's not the one that most people are weakest in. Most people, especially women, are weak in the lower abs. And since the lower abs keep your intestines and everything else that's in your stomach in place, you want to have them strong enough that they draw upwards and inwards. So the way to do that is to work the lower body. If you get into an L position, your lower back is on the ground and you can feel it. Object on these exercises is don't lower your legs any lower than your lower back can handle. So if it's starting to come off the ground, don't go any lower because you're not gaining strength. You may be injuring yourself. Easiest option, one leg at a time. Legs are going to be bent, so you're just going to tap one leg down and tap the other. Easiest option. Once you've mastered that and you can feel your lower back on the ground, you can do 2 legs at a time. And you can go down a little bit, you can go down a lot. You decide, by the determining factor being your lower back staying on the ground. Once you've gone past that and it's comfortable and safe, you can do it with straight legs. And again, you can do 1 leg at a time, so you just drop 1 leg down, come back up, and the other leg. Or you can do both legs, concentrating on where your lower back is. Breathing out on the rise and breathing in as you drop. If that lower back comes off the ground, don't go so low. Or many people can get down with their legs straight, but they can't get back up with their legs straight. So you can go down straight and you can bend them on the rise. So you get down to here and you relieve the pressure a little bit by bending the legs to get back to the top. So you have a kind of a circular motion. It can be done with 1 leg or 2 legs. So that's the lower main ab group. And again, the determining factor is where your lower back is on the ground. You want to press it into the ground. From here, we'll move to the obliques. So all she's going to do is turn on her side. You're going to have bent legs. The top leg is about 4 inches off the other. Your head's going to be on the ground, and you're going to look right up at the ceiling above your body. So you're going to take your hands just like this and look right up at the ceiling, because now you've twisted your body slightly. So you're going to get the muscles that move diagonally across the body. By having your knees slightly apart but your feet together, it allows you to twist a little bit more. And again, you've got some upper and you've got some lower. So the more she can face the ceiling, and some people are more flexible than others, but you want to try to see if you can get both elbows to the ground when you're lying down. And the nose, again, is coming straight up in the air, and she's just lifting it. And you'll notice she's not going very high compared to a regular crunch where you can go higher. The muscle here, again, the rib to the hip bone, and you're squeezing your glutes at your rear end nice and tightly so that you're stabilizing the lower body as you lift the upper body, and you're getting the diagonal across here. If we want to work the lower aspect only, she relaxes her head, and you got choices. Easiest choice, just lift 1 leg up in the air, about 1 inch or so, drop it back down. Yep. And then if you're a little bit better and you want to add something to it, try to lift both legs off the ground. They don't have to come high. They can stay low or they can come much higher. You decide. You breathe out on the rise and you breathe in on the drop. Once we've done the obliques and the main muscles, if we sit up, we can add a lot of back work in at the same time as we're doing front work.
To watch the other segments in this video series or for
Okay, so this exercises you need to teach maybe on the day of discharge, or if you want to teach early and make them to do early. In this video, they did all the abdominal exercises from in grade 5. So if you are doing, you can you have to assess the muscle power. If it is grade 2, then you have to start from grade 2, or grade 3 means grade 3. So here in this video they have done everything in grade 5. Is that clear? So I'll show you one more video for abdominal exercises, then we will go to the next.
Hey everybody, it's Dr. Joe, and today I'm going to show
Again, this is also core stability exercises.
you 7 easy core strengthening exercises. So let's get started. Disclaimer alert, disclaimer alert. Before we start, if you haven't subscribed already, make sure and click on the button. So we're going to start off with some pretty easy core strengthening exercises and then get to a little bit harder. So the first ones we're going to start off with, you're just going to lie down on the floor. Now, if you are not comfortable getting on the floor, you can do this on your bed or a couch. You just want it to be firm enough where you can do the movement. So a lot of people say they can't get up off the floor. Just get on your bed or your couch and do it, and that should be fine. So we're going to start off with a pelvic tilt. With the pelvic tilt, basically what you're trying to do is flatten out your back onto the floor. So that little curve that we have in our back, you're moving that pelvis, or you're tilting the pelvis to push it flat down. And that kind of just contracts those core muscles. So once you do that, if you can see that movement, almost like you're going to lift up your bottom, but you're not going all the way up. Hold that for about 3 to 5 seconds. And then relax. So just start off with doing about 10 of those. And this is just really to kind of start getting them loosened up, getting those movements, getting the muscles starting, but not going too crazy yet. So again, just a 3 to 5 second hold, really trying to flatten it out. If you need to put your hand under there as a target, you can, but you really want to feel that back flat on the floor, and then do about 10 of those. So after you get those, get everything kind of loosened up in there, you're going to go into a full bridge. So now you're just lifting your bottom up off the floor, and you want to lift it to about where it's level, but not arching your back, and really just going controlled the whole time. So you're coming up, and then once you start to come back down, come one segment at a time. So you don't have to pause at each segment, but really control it. So you're going up, and then nice and slow coming back down. So again, just starting off with about 10 of these. If this becomes really easy, you can do 15 to 20, up to 25. If you get to 25 and they're pretty easy, then you can actually start doing one-legged bridges. So just coming up and then coming back down. Still trying to keep everything level though. So if you feel like you go up and your hip is dropping, let me do it on this side so you can see it. If it's dropping like that, that just means you're not quite strong enough and ready for it. So then go back to the 2 legs. So then we're going to go and use a Swiss ball. Today I'm going to be using the King Athletic Swiss ball, and if you're interested in purchasing it, make sure you click on the link up here. So now we're going to go into a prayer plank on the ball. So I would start with a modified, which is on your knees, because this one is a little bit harder. Using a Swiss ball makes an uneven surface. So just kind of place your arms on the Swiss ball and then bring your knees back, tucking in the butt. So squeeze those butt muscles in and try and be in a fairly straight line when you do it. If this is easy, if you can hold it and get to a minute and you're just kind of like do, then you can come up into a full plank. But really squeezing in that butt, holding it nice and tight, keeping everything tight so you're not sagging down, you're not coming up like that. You're really trying to stay in a nice straight line. So again, starting off maybe 10 to 15 seconds and then working your way up from there. So the next one with a Swiss ball, you're going to lie down and put your legs on the ball. So bend the knees and get kind of in a comfortable position. If you need a pillow for your head, you can. If you just want to lie down flat on the floor, you can do that as well. But keep those knees just a little bit bent, and then you're just going to kind of rotate your hips from side to side. So almost like a trunk rotation, but now you're just getting those core muscles strengthening in a rotation position. So you don't have to go and rotate all the way down. Just go until you feel a little bit of tightness, and then come back up. But keep it nice and smooth and controlled. So again, just doing maybe 5 on each side, and then you can progressively go down deeper if you need to. For the next Swiss ball exercise, you're going to be sitting on the Swiss ball. When you sit on a Swiss ball, you want your hips and your knees to be about at 90 degrees. So your feet are nice and flat, but your knees aren't coming right up. So you want to be in a pretty comfortable position. So with this one, I have a pretty heavy weight here. You probably just want to start off with maybe a 2 or 3 pound weight and then work your way up from there. So just take the weight and put it straight out in front of you, and then just gently rotate from side to side. So again, this is working the core in a rotational movement. Try and keep your back nice and upright, and just gently rotate back and forth. If you feel like the weight is starting to drop and you've only done like 2 or 3, it probably means the weight is too heavy, and then just get something lighter. You can actually do these if you're not quite ready for a weight. Just clasp your hands out in front of you and still do that rotational motion. So you're still getting a good core strengthening exercise with this. So if you're not quite ready for that weight, you can actually do that as well. Whoa! So the next exercise is a tall kneeling lean back. This works your hamstring as well as your core. So as you can see, I don't have anything anchoring my feet. Sometimes people do need something holding their feet down to do this. Again, you can go modified and just go here. You can place your hands on your hips here, or you can just have them down by your side. But if you just want to start right here, you can. I'm already feeling my core and my quads and my hamstrings working, but once you start going further back, you're going to feel it a lot more. So don't try going really far back in the beginning, because you need good flexibility with this as well. Just try a little bit, and then you can try a little bit further. So I just start off with about 10 or 15 of those and then work your way up. So the last exercise is going to be standing. So the last core exercise is going to be a simple elbow to knee standing up. So you can either do same side or you can do opposite back and forth. So this one requires some balance while you're doing it. So if you don't have really good balance, you might want to start off doing these sitting or lying down, and then you can work your way to standing up. Some people put their hands all the way behind their head. I just kind of like to hold my hands up a little bit. So you can do same side, you're kind of meeting in the middle. So you're not curling your upper trunk forward, you're just kind of crunching as you're going. Or you can alternate sides back and forth. So this is not only working your balance, but it's working your core as well. But see, I'm still pretty upright. I'm not coming down and bending my back. I'm just meeting in the middle to really work those core muscles. So again, you can start off 5 on each side, 10, work your way up to 20. If you're getting to 20, 25 on each side and it's easy, then you can start doing some other stuff. So there you have it. Those were the 7 easy core strengthening exercises. If you're interested in purchasing the King Athletic Swiss Ball, make sure and click on the link.
All these you can do in case if your patient is really strong. But in case if your patient is weak, then you have to go with simple abdominal exercises like this.
Lie on your back. Your knees should point towards the ceiling and your feet should be flat on the floor. Now, slowly take a deep breath in and place your hands on your thighs. As you exhale, raise your body off the floor and slide your hands up your knees. If you feel comfortable, you can hold this position for 4 counts. Now slowly return to starting position. You can repeat this exercise up to 10 times. The back is one of the areas that can get deeply affected due to pregnancy. The normal curvature of your spine deepens further due to the growing weight of the abdomen, and this can cause backaches in the postpartum period. Before you start this exercise, make sure you are not suffering from diastasis recti, a condition in which the ab muscles widen. Also, If you have had a cesarean section, avoid doing any abdominal exercise for 4 to 6 weeks. As your stamina increases, you can start doing up to 4 sets of this exercise every day. Once you feel comfortable doing this exercise, you can proceed to doing the full crunches as well. Make sure that you don't exercise on an empty stomach. Do have a piece of fruit. Take care of yourself and happy exercising.
Okay, so these are about the abdominal exercises. I'll show you a little bit of pelvic tilting exercises.
Hi, I'm one of the physios from the Royal Free NHS Foundation Trust, and today I'm going to be taking you through an exercise called pelvic tilting. Terry, as my patient, will sit on the edge of a comfortable surface, either a bed or a chair, and what she's going to do is slowly curve her spine and roll her pelvis forwards as far as pain will allow, and then she will reverse and tuck her tailbone underneath her and curving her spine the opposite direction. She'll continue to move forwards and backwards for approximately 30 seconds to try and learn what movements her spine is capable of doing. This exercise can also be done in line. So if I get Terry to come and lie down on her back, with her legs bent up in this position, she can then practice arching her back and tucking her bottom underneath her. Fantastic. And again, she's going to roll from position A to position B over the course of 30 seconds. And relax. Good.
Now is we're going to try and strengthen our postural muscles and pull in our lower back as well to perform some pelvic tilts. I'm going to use a wall today, but you can do it without the wall, but it is better to place yourself against the wall just so you can feel the resistance. So place your heels, bottom and shoulder blades against the wall. You will find that your shoulder will naturally slouch forward into your natural standing position. So what we need to do is just try and straighten up through our bodies. So head against the wall, shoulder blades pulled back. You'll find that you will arch through the lower back as well, and all I want you to do is just pull your pelvis under to flatten it against the wall. Keep your knees soft and just hold that for a few seconds, little pause, and then just kind of release naturally from it. So it is quite tough just to hold in that position for a few seconds. So we'll perform that again. Soft knees, lower back into the wall, shoulder blades press firmly, head against the wall, draw your shoulder blades back, squeeze them, and then just tilt your pelvis against the wall. Hold it for a few seconds, keep breathing, and then release. Again, we're going to perform those for 10 to 15 reps as well. Please give those a whirl. Thank you. Okay, ladies. So what we're going to try now is we're going to try and strengthen
These are the exercises you need to teach in postnatal, post-operative gynecological surgery. So all these exercises you will be teaching for abdominal exercises. In case of vaginal hysterectomy, you need to add up the pelvic floor exercises also. Okay, so along with the breathing techniques and chest expansion techniques, posture care, bed mobility, all those things, in abdominal surgery, you will be stressing more on the abdominal exercises. In vaginal hysterectomy, you have to stress more on pelvic floor exercises. So next class, we will be seeing about the urinary dysfunction. So in that class, I'll show you a lot of videos about the pelvic floor exercises. Okay, so now we will just move on to the next one. That is mastectomy. So after mastectomy, what are the things we have to teach the women. Okay. So mainly after mastectomy, they will be having problem with the upper limb movements, and they will be having problem with the thoracic. That is because of the surgery, the thoracic will be tightened, and the pectoralis major and minor muscle will be tightened, and they will be going for stoop posture. So we have to avoid the stoop posture, as well as we have to maintain the proper chest expansion. So when they go for a stoop posture, obviously the respiration also will be affected because of the posture. So main problem is stoop posture. So we need to give them good chest expansion exercises. We need to maintain the pectoralis major and minor muscle length. That means we have to avoid the chest tightness of those muscles. Along with that, we have to teach them lot of upper limb exercises, because after mastectomy, many of them will end up with lymphedema. So that means, like, when they do a mastectomy, they will be damaging lot of lymph nodes. So because of that, the lymphatic drainage will be blocked, and it will lead to bilateral upper limb edema. So our main role in mastectomy is to maintain the posture, especially the thoracic posture, to maintain the respiration, and to avoid the or prevent the lymphedema. So these are our major role. So for these things, first thing is we have to teach them good diaphragmatic breathing exercise. The next is circulatory exercises to improve the circulation in the upper limb, like making the fingers close and open, that is making the fist, then moving the wrist up and down, then elbow, then the shoulder. So this exercises will help you to increase the circulation, and this will help you to reduce the edema in the upper limb. So apart from that, we have lot of active assisted exercises that will be helping you to reduce the edema in the upper limb. So first is wand exercises. With the help of the wand, since the limbs are heavy, actually because of the edema, the upper limb will be very heavy, and because of some stretch pain in the wound side, the women will not be able to do the exercises. So that's why we go into active assisted exercises instead of active exercises. So this active exercise, assisted exercises, can be using the same opposite hand, or can be using a wand. So this wand will help you to do the movement. So this is shoulder flexion exercises using a wand. So you can also do shoulder abduction, adduction exercises using the wand. You can also do elbow winging, that will help you to reduce the circulation. Then side bends, that will help you to increase the thoracic expansion. Then chest wall stretching, this will help you to increase the reduce the tightness of pectoralis major and minor. So this one you have to do at the corner of the wall. Okay, so wall stretch, finger ladder, all these will help you to increase the chest expansion, as well as the reduce the tightness in the upper thoracic, so that you can maintain the posture. Okay, so we will see the video now.
This video is to complement the Your
1 minute, I'll show you the week 1.
This video is to complement the Your Journey Through Breast Cancer Surgery booklet. You should have received this booklet from your healthcare team. If you have not received a booklet, please contact your healthcare team. Exercise after breast cancer surgery is an important part of your treatment and recovery. Exercise can help you reduce joint stiffness, move your arm and shoulder more easily, strengthen muscles, and get back to normal daily activity. It's important to know what you were able to do before surgery, called your baseline movement, so you can track your recovery. To know your baseline, try these exercises before you have surgery. You should avoid vigorous exercise and sports in the early weeks after surgery, but it is important to stay active. Talk to your surgeon about how much activity is right for you now and when you can return to your previous exercise and sports. Work towards 30 minutes of activity most days. You may find that light housework is a helpful way to get gentle exercise. Ask your surgeon when you can lift more than 4.6 kilograms or 10 pounds. These exercises are for all types of breast surgery except breast reconstruction. If you have had breast reconstruction, speak to your surgeon about what exercises you should do. These exercises are for patients with or without a drain. These exercise instructions refer to your affected side, the same side of your body as your surgery, and your unaffected side, the side of the body that didn't have surgery. Do the exercises on both sides of the body if you've had surgery on both sides. If you have any concerns about how well you can move, your level of mobility, or strength, talk to a physiotherapist. Week 1. Start Week 1 exercises 24 hours after your surgery. Do these exercises until you have the same movements and range of motion that you had before surgery. If you have a drain, it's normal to notice more fluid in your drain after you do these exercises. Make sure your drain is well attached to your clothing and empty it before you begin the exercises. While you exercise, you may feel some pulling and stretching of your skin and surrounding tissue. It is not uncommon to have numbness, burning, or tingling around the incision or armpit area before you exercise. These sensations can exist during your exercise routine as well. If you have had a pre-existing shoulder injury or have sharp or pinching pain in your shoulder while performing any of these exercises, please stop the exercise and consult your healthcare team. If you're worried about your pain while you exercise or have any other questions, talk to your healthcare team. It's important that you take the time to go through and complete the movements of each exercise. Do each of these exercises 5 to 10 times, 2 to 3 times per day. Seated posture. Sit in a firm chair or on a stool with your back straight and your feet on the floor. Keep your chin tucked in and pull your shoulders back towards your spine. Tighten your stomach muscles by pulling your belly button in. Hold this position for 5 to 20 seconds, and then relax. Repeat 5 to 10 times. Active hand pump. Do this exercise while you're sitting with your hands on a pillow in your lap, or laying down on your unaffected side and supporting your affected arm on a pillow. Slowly open and close your hands as far as possible, and repeat 5 to 10 times. Shoulder shrugs and circles. Do this exercise either standing or sitting. Lift both of your shoulders up towards your ears, then circle them back and down. Return to the starting position and repeat 5 to 10 times. Assisted shoulder flexion. Do this exercise on your bed or on the floor. Lie on your back with your knees bent and both arms by your sides. Use the hand on your unaffected side to hold the wrist of your affected arm. With your affected elbow slightly bent, gradually raise your arms up towards the ceiling, and then if you can, over your head. Hold this position for 5 seconds and then relax. You may not be able to raise your arm all the way in the first few days. Return your arms to the starting position and repeat this exercise 5 to 10 times. Butterfly stretch. Do this exercise on your bed or on the floor. Lie on your back with your knees bent and clasp your hands together loosely behind your head. Point your elbows towards the ceiling. Slowly move your elbows apart and down to the floor. Hold this position for 5 seconds and then return to the starting position. Repeat this exercise 5 to 10 times. Shoulder abduction. This exercise is best started near the end of week 1 if you have had a pre-existing shoulder injury or have sharp or pinching pain in your shoulder while performing this exercise. Please stop this exercise and continue with the rest of the exercises. Sit in a chair with your affected side about 1/2 to 1 meter away from a wall. Keep your body straight and your shoulders level. Do not shrug your shoulders or lean to the other side. Place the fingertips of your affected hand on the wall, and with your fingers, climb up the wall slowly, as high as you can. Lower your hand back down by your side, and repeat 5 to 10 times. You can start week 2 exercises in week 1 once it's comfortable to do all of the week 1 exercises.
So next is week 2 exercises.
This video is to complement the Your Journey Through Breast Cancer Surgery booklet. You should have received this booklet from your healthcare team. If you have not received a booklet, please contact your healthcare team. Exercise after breast cancer surgery is an important part of your treatment and recovery. Exercise can help you reduce joint stiffness, move your arm and shoulder more easily, strengthen muscles, and get back to normal daily activity. It's important to know what you were able to do before surgery, called your baseline movement, so you can track your recovery. To know your baseline, try these exercises before you have surgery. You should avoid vigorous exercise and sports in the early weeks after surgery, but it is important to stay active. Talk to your surgeon about how much activity is right for you now, and when you can return to your previous exercise and sports. Work towards 30 minutes of activity most days. You may find that light housework is a helpful way to get gentle exercise. Ask your surgeon when you can lift more than 4.6 kilograms or 10 pounds. These exercises are for all types of breast surgery except breast reconstruction. If you have had breast reconstruction, speak to your surgeon about what exercises you should do. These exercises are for patients with or without a drain. These exercise instructions refer to your affected side, the same side of your body as your surgery, and your unaffected side, the side of the body that didn't have surgery. Do the exercises on both sides of the body if you've had surgery on both sides. If you have any concerns about how well you can move, your level of mobility, or strength, talk to a physiotherapist. Week 2. Start week 2 exercises in the second week after your breast surgery. If you're finding any of the week 1 exercises are still hard to do, you can keep doing week 1 exercises in week 2 along with the week 2 exercises. You shouldn't feel pain during these exercises, but it's normal to feel some pulling. Some of the exercises are stretches. Hold the stretch for 5 to 20 seconds. Some of the exercises are repeat movements, 5 to 10 times each. Trunk side bending. Repeat. Sit in a firm chair with your back straight and your feet flat on the floor. Place your hands behind your head. Slowly bend to one side as far as you can until you feel a stretch in your opposite side and under your arm. Return to the starting position and repeat on your other side. Repeat 5 to 10 times. Shoulder flexion stretch. Hold. Stand behind a chair with both of your hands on the back of the chair. Back up a few steps and bend forward until you feel a stretch in your shoulders. Keep your back flat and your elbows slightly bent. Do this exercise with a slight bend in your knees. Stop the exercise if it causes discomfort in your back. Hold this position for 5 to 20 seconds and then return to the starting position. Pectoralis stretch, supine. Hold. Do this exercise on your bed or on the floor. Lie on your back with your knees bent and your arms out to your side at 45 degrees. Keep your shoulders down and turn your palms face up. Hold this position for 5 to 20 seconds and then relax. You should feel a stretch in the front of your shoulder and across the top of your chest. When you are able, move your arms further away from your body, trying to get them to 90 degrees and then to 120 degrees. Lower pectoralis stretch. Hold. Do this exercise on your bed or on the floor. Lie on your back with your knees bent and your palms facing up. Bring your arms out to your side to 120 degrees. You should feel a stretch in the front of your shoulder and across your chest. Hold this position for 5 to 20 seconds and then relax. Shoulder abduction. Repeat. Sit up straight in a chair with your arms at your side and look straight ahead. Face the palm of your affected hand forward and lift your arm out to the side towards the ceiling. Keep your elbows slightly bent and your shoulders down. Slowly return to the starting position and repeat. When your arm is raised, you can bend your wrist up and down, wave, for an added stretch. Repeat this exercise 5 to 10 times. Active shoulder flex, one arm. Repeat. You can do this exercise standing or sitting. Tuck in your chin and pull the shoulder back on your affected side. Lift your arm in front of you as high as you can and keep your elbows slightly bent. Slowly return to the starting position and repeat. When your arm is raised, you can bend your wrist up and down, wave, for an added stretch. Repeat 5 to 10 times.
Okay, so like we have seen 3 different type of surgery. One is like vaginal surgery, another one is like abdominal surgery. That is like surgeries through vagina, surgeries through abdomen, and last one is like mastectomy. So sometimes we will be getting the referral in the pre-operative. So pre-operative itself, we will be able to start the treatment part. Sometimes we will be getting the referral post-operative, and sometimes maybe at the day of discharge. So according to the setup, you have to change your protocol time. So once you get a referral from the pre-operative, you can start everything at early as per today's class. And if you are getting post-operative, you can also go with day-wise protocol. So day-wise protocol means like you can follow the same thing in the cesarean section. Like in case of midline insertion, it should be 5 to 7 days. In case of fenestrial incision, it should be 3 to 5 days. Then for the vaginal hysterectomy, you can follow the same protocol as your vaginal, like as your normal delivery. Okay, so you can follow the same day-wise protocol. Only thing is, if you want to add up some exercises, that is, you will be giving so much stress for the respiratory exercises and so much stress for the circulatory exercises. You can also teach the bed mobility. But here you have to keep this in mind that delivery is something a normal physiology, but this surgery is something pathological physiology. That means abnormal physiology. So in normal physiology, they will be able to do the exercises as normal as they can, and they will be becoming to they will be trying their maximum level best to come back to their original state. But in this pathology, since like it is abnormal, it will say take some time. So you need to listen to the patient's body condition, and accordingly you have to progress. You cannot push the patient so much in case of this gynecological surgery. Okay? And in mastectomy, you need to you have something, or like you will be having some do's and don'ts, so you have to stress all those do's and don'ts to the patient. So first thing is, they have to do the exercises slowly. They should not push the exercises too much. Then second thing is, if the body has some problem, they have to listen to their body. And if the pain is very severe, if they feel unusual heaviness, tightness, then they have to visit stop the exercises and visit the doctor. Then sometimes, like, it is normal to have all the stitches and heaviness in case of this mastectomy. And if the numbness and other thing are becoming severe, then they have to visit the doctor. But usually they will have numbness, heaviness, all this tinkling pain, everything is normal in case of a mastectomy. Okay, and they should always wear loose clothes because suddenly they may have lymphedema and they will find it difficult to remove their dress. So always they have to go for loose dress, do the exercises slowly, and do the exercises as much as they are comfortable. And they have to avoid carrying handbags, wearing rings, and wearing bangles, watches, wrist, any band or anything in the affected hand, in case if they have done any in case after their lymphedema. So in case Okay, so in case if they have done bilateral surgery or bilateral mastectomy, then they have to avoid all these things on both the hands. So mainly, like, it will take some time for them to get back to normal in case of mastectomy. Okay, so other gynecological surgery, it will be little more easy for them to come back to normal. So so majorly, as a summary, I can tell you our main role is to prevent certain complication, then to enhance the independency as early as possible. So to prevent complication, concentrate on respiratory and circulatory exercises. So to bring back the independency, then make them to be mobile as early as possible. So to make them to be mobile as early as possible, we need to strengthen the weaker muscles. So here the weaker muscles will be the pelvic, that is core muscles, as well as the pelvic floor muscles. So these are the two muscles we are going to concentrate on. Is that clear? So lastly, there will be some complications. So immediate will be chest complication, DVT, and wound infection. So chest complication, go with breathing exercise and lot of breathing techniques. DVT, you have to give antithrombotic statins. Wound infection, you can give IRR. So normally IRR is placed 50 to 70 centimeter away from the wound area in a perpendicular direction. Then if they have any voiding problem, they can do a lot of pelvic floor exercises. They have to, definitely they will have little bit voiding problem, because after the surgery, it may not be little normal. So they can avoid straining, and they can drink a lot of fluids, and they can do a lot of pelvic floor exercises. So this will help them to reduce this problem. So there are some advisors. So same like your cesarean section, they cannot come back to normal immediately. It will take at least 1.5 to 2 months for them to come back to normal. So sorry, 2.5 to 3 months to come back to their normal. Still that they have to do the exercises slowly, and they have to improve on their day-to-day activity slowly. Then they can resume back to normal lifting exercises. That is like maximum they can lift 1 kg of weight after 4 weeks. Then after 3 months they will be able to return back to their normal. They can go for driving after 4 to 6 weeks. They can go back to their normal life after 3 months. So after 3 months they will be able to get back all their hobbies and sexual life as well. So lifelong advices after this gynecological surgery is they have to continue with pelvic floor exercises, because inside they would have left some parts of the uterus. If they don't do proper pelvic floor exercises, then they will be uh, ending up in prolapse. So to avoid that, they have to do good pelvic floor exercises, and they have to do good abdominal exercises to avoid insertional hernias. Okay, so remain active throughout their life, maintain their normal weight, avoid obesity, and they have to maintain their fitness, avoid weightlifting for longer time. So these are the lifelong advices, because normally this gynecological, after this gynecological surgery, the women may lead to menopause, and in the menopause, the women has certain problems like osteoporosis and obesity. So to avoid that, they have to remain active, and not only that, they have to remain fit. So these are the advices you will be giving for them lifelong. Okay. So any doubt in today's class? So we have one more topic. Uh, uh, that is urinary dysfunction. Then we will have a overall tutorial session for all the practicals. Is that clear? So maximum I'll be needing 3 hours. I think next week is your last week, right? So I will try to complete maybe like if possible, we will have one more class this week, or we will have it next week, because Thursday is a holiday for us. I'm planning to take leave on Friday. So maybe next week we will have 3 hours session. Is that clear? So let me know if you are free on Monday, so that we can have 2 hours. Then Tuesday we will have 1 hour of tutorials of all the session, so that we will be able to complete. So if no other doubt, then we can end the session. Thank you.